For months now, we have been working with Washington University medical experts to help answer questions you have about coronavirus. And joining us once again is Dr. Jason Newland, an infectious disease specialist at Washington University and St. Louis Children's Hospital. And Dr. Newland, a viewer writes, we have seen the COVID trends go in the wrong direction. If this is a second wave, even if we flatten the curve, won't there be a third wave and a fourth wave?
Well, we've definitely seen another rise in cases, and whether we want to call it another wave because we had a one before, I think we know the virus is here. And I'm hoping we're all learning what we need to do to prevent the transmission of this virus. We have learned more and more, one would say, each time with these waves. So now we know we need to be masking, and maybe we weren't doing that as well. So let's abide by the principles as we get through this and we flatten this curve. So we're gonna wear our mask, we're gonna social distance, we're gonna wash our hands, and we're gonna stay away, and we're not gonna go out when we're sick. I think these are the things that allow us to not have waves and waves, and will keep our transmission low.
Another viewer writes, says, I'm 76 in good health and tested negative 2 months ago. How soon does it make sense to be tested again?
Well, I'm glad you're in good health, and I think you shouldn't have to be tested again because you're not going to get those symptoms that makes you feel like you need to be tested. So by doing our social distancing, by wearing our mask and washing our hands, there is no need for you to actually go get tests. We know tests can be hard to come by right now because of all the other parts of the country that are surging with cases. And so what I would recommend is don't worry about getting testing and just worry about those practices that prevent the transmission or prevent you from getting sick.
Here's our next question from a viewer. Can you tell me what a quarantine should look like? Our son tested positive but is asymptomatic. Should he be confined to his own room? Should he have his own bathroom? Should we wear masks in the house?
So I'm sorry he's been infected. I think what he should do is you should isolate him to his room as much as you can. If you can have him use his own bathroom, I would have him use his own bathroom. I would wipe down the surfaces of that bathroom if he can't use it or that's a shared bathroom. I think he needs to be kind of as away from you as much as possible. And you don't have to wear a mask if you're not around him. But if he comes out and you might be near him, I think I would have everyone wear a mask. Lastly, his isolation starts from the day of his test, the day that you obtain his test, for 10 days. And then your quarantine starts from your last exposure to him for 14 days. All important things that we prevent transmission of this virus.
Speaking of masks, this viewer asks, why do I keep hearing that masks prevent the spread of the virus but won't protect a person from getting it? This is so confusing. Shouldn't it work both ways?
So this is a great question. I appreciate this a lot. We have learned that with those cloth-based masks, if we'll all buy into this, we will prevent ourselves from transmitting it to each other. So if you're not wearing a mask and I'm wearing a cloth-based mask and you're sick and you're coughing, I can still get it because the cloth-based mask isn't as effective as some of our surgical masks. But we have learned based on some good studies, even one in Springfield, Missouri, that if we're all wearing the mask, we will prevent transmission. Our community needs to come together and do this together, and we will flatten this curve. We will also decrease transmission, and we'll get to do the things we need, especially our children back in school.
Another viewer writes, since children under 10 don't seem to be affected much by coronavirus, why shouldn't they be back in school?
Well, children less than 10 can be infected, but they do make up a less amount of the infections we're seeing, probably less than 5% of the cases. We also know that children are less likely to transmit the virus, but they can transmit the virus. So while I believe that our elementary school kids could go back to school and be safe with all the things that we've done to do that, we have to remember that our educators, they need to feel safe. And right now, it's hard to feel safe when you're seeing all of these cases and the increase in cases. So what I want to ask all of us is, as a community, we need to band together to decrease this transmission by wearing our masks, social distancing, washing our hands. And that should help in addition to all the things the schools have done to make our teachers feel safe, and we'll have our kids back in school, not only those less than 10, but even our middle school and high schoolers.
This viewer wants to know, how bad is just one hug?
You can have one hug. Make it quick, wear masks, but just know that there's always a little risk. But yes, you can have a hug. And if you're hugging loved ones you live with, definitely okay. Everything has a risk, but we all need a hug sometimes. Make it quick and wear a mask.
And this viewer wants to know, how optimistic are you about the possibility of having an effective vaccine by the end of this year?
So first, I'm optimistic we're going to have a vaccine. I think that's super important. Whether it's by the end of this year or maybe in the beginning or the first part of next year, I think we'll wait and see. We know they're out there. We know that St. Louis University is already enrolling in one of the vaccine trials that has the most promise right now, and we know Washington University will start with another vaccine candidate here in the coming weeks. So they're there, but in the meantime, let's do the things we can to prevent ourselves from getting the virus.
Dr. Newland, thank you as always. If you have a question for the doctor, don't call, just text us at 444-5125, 444-5125.